Welcome back. Today, we are going to follow the money. We're looking closely at the healthcare sectors, specifically the managed care industry, to see how corporate reporting actually reveals the true priorities of health insurance providers. So let's dive into this explainer and unpack the strict standards that hold these massive companies accountable. It's a question we've all asked, right? You pay your monthly premium, which can be a painfully high amount, and you think, where is all this cash actually going? How much of it is genuinely funding patient care, and how much is just getting swallowed up by admin costs or corporate profits? Well, today we aren't just guessing. We're going to look at the exact standardized metrics that force insurance companies to answer this question publicly. Here is our roadmap for the explainer. 1. Standards in managed care. 2. Defining access to coverage. 3. The medical loss ratio. 4. Disclosing access policies. And finally, 5. Why these metrics matter. Let's start right in with Section 1, Standards in the Managed Care Industry. Before we get into the metrics, we need to know who exactly we're talking about here. According to the industry standard, the managed care industry is made up of entities that offer health insurance products. This spans the whole spectrum. We're talking individual retail plans, your standard commercial employer-funded plans, and government-assisted programs like Medicare and Medicaid. These entities also manage pharmacy benefits. Basically, if you've got health insurance, you are more than likely interacting with a managed care entity. Now, these massive companies don't just get to make up their own reporting rules. We are pulling our data today directly from the SASB standards, specifically the healthcare sector guidelines for managed care. These are rigorous frameworks designed to help everyone understand sustainability-related risks. And in healthcare, that risk means looking very, very closely at patient access and the actual quality of care. That brings us to Section 2, Defining Access to Coverage. So, the crucial point here is the core tension driving the entire managed care industry. These entities have to balance controlling their plan costs and managing rate hikes while simultaneously making sure that all applicants actually have access to coverage. And they have to do this regardless of a person's health status or pre-existing conditions. It is a massive tightrope walk. How do they control costs without just shutting out the vulnerable people who need care the most? Let's move to Section 3 and see how this tension turns into quantifiable math, the medical loss ratio. I want you to picture every premium dollar you pay as a pie. Metric HCMC 240A.1, the medical loss ratio, essentially demands that companies show us exactly how that pie is sliced. They have to disclose what slice goes directly toward medical claims and improving the quality of care versus the slice that goes toward everything else, marketing, administration, and corporate profit. Let's break down exactly how they calculate this because the formula really leaves no room to hide. Step 1, you take the total sum of all incurred medical claims and you add the quality improvement expenditures to it. Then, Step 2, you simply divide that total by the healthcare insurance premium revenue. The percentage you get at the end of that equation is the medical loss ratio. It's the ultimate transparency check, telling us precisely what percentage of revenue is truly funding healthcare. Let's zoom in a little closer on the first part of that math, incurred claims. This is clearly defined as the total amount spent on medical claims, paid out to policyholders, as well as payments made directly to healthcare providers. So if you go to the hospital and your insurance pays the surgeon, that exact payout sits right here in the incurred claims bucket. But remember, it's not just direct payouts for surgeries. Companies also get to include quality improvement expenditures in that calculation. This covers things like investments in patient safety programs, preventative care efforts like a free annual checkup, health management programs, and even investments in healthcare tech. These are the strategic moves meant to actually enhance the safety and delivery of patient care. Now, an insurer can't just mash all their numbers into one giant, misleading bucket to look good. The SASB standards mandate that entities have to disclose this medical loss ratio consolidated, sure, but also broken down by business segments. This means showing the ratio for small employer groups, large employer groups, and individual retail plans completely separately. Why? Because a company might be incredibly generous with their large corporate clients, but highly restrictive on their individual retail plans. Breaking it down forces total transparency across the whole board. Next up, Section 4. Disclosing access policies. We just looked at the hard math, but now let's look at the narrative. Specifically, metric HCMC 240A.4. This rule requires entities to actually describe their policies regarding customer access to coverage. Crucially, they have to publicly disclose how they integrate access considerations when they're deciding to increase plan pricing. if they decide to hike up your rates, they must openly explain how they factored in the impact that hike will have on people's ability to actually afford the plan. And they have to be very specific about who they're talking about. The disclosure must explain how they handle pre-existing conditions. The standard defines this as literally any medical condition, illness, or injury that existed prior to your application for a plan. We are talking chronic conditions, previous surgeries, ongoing treatments. Insurers have to explain how their pricing policies handle real people with complex histories without just unfairly pricing them out of the market. Building right on that, the exact same goes for overall health status. This is defined as the total physical and mental well-being of an individual. It's affected by this complex web of factors: medical history, current conditions, lifestyle choices, even family history. Once again, the standard demands that these managed care entities explicitly state how their pricing strategies take all these incredibly diverse human realities into account.
But look, having a nice policy written on a piece of paper isn't enough. The SASB standard dictates that entities must disclose whether they are subject to jurisdictional laws regarding customer access. And even more importantly, they have to identify the specific internal systems they use to monitor their own compliance with those laws. They basically have to prove they are checking their own homework and ensuring they don't violate regulations that are meant to protect patients.
Finally, let's wrap this up with Section 5, why these metrics matter. It's really easy to get lost in accounting ratios and corporate policy, but we absolutely cannot lose sight of why this is being tracked. The SASB topic summary states this perfectly. Quote, "These improvements most significantly affect segments of the population that tend to have lower rates of insurance coverage." End quote. Controlling costs and ensuring access isn't just a business problem for a spreadsheet, it's a massive social mechanism. The people most impacted by an insurer's medical loss ratio or their policies on pre-existing conditions are almost always the most vulnerable folks in our society. Which brings us right back to you and the question we started with. The frameworks exist, the standards are crystal clear, and the data is out there in these corporate sustainability reports. So, I'll leave you with this. Next time you pay a premium, how much of your slice is actually funding care? I highly encourage you to look up the medical loss ratio of your own provider. You really might be surprised by what the numbers reveal. Thanks for joining me on this explainer, and keep asking the tough questions.